Hello class, my name is Juan Ortiz Jr. and today we will be talking about child obesity. Child obesity. Now, early childhood is the foundation for many weight-related behaviors, which starts with diet and activity. However, very little obesity research targeting this group has been conducted, not to mention how society lets this problem go unnoticed. So the foundation here is weight-related behaviors, diet and activity, the group with little research, and society deems them cute and chubby. Our children are obese. The National Health and Nutrition Examination Survey between 2009 and 11 indicated that 1 in our 4 children aged 2 to 5 years are overweight or obese. This increases the risk of becoming overweight and obese adolescents and adults, which leads to long-term health problems. What are they, you may ask? Well, diseases linked to childhood obesity are diabetes, which, by the way, it has also increased in children as well, high cholesterol, low self-esteem, high blood pressure, early heart disease, bone problems, and severe psychological problems. Going back to low self-esteem as well, it's a broader picture with the psychological problems. Now, early childhood is a critical period in obesity development, and that is why it's important to target for healthy eating and physical activity interventions to establish healthy weight gain trajectories. Childcare of some sort includes daycares and education centers, provide care for approximately 30 to 40% of the nation of the children under 6. They spend on average 30 hours per week in this environment. Therefore, it is to no one's surprise that people are a part of the staff play a major role in developing children's health behaviors and reducing the risk for obesity by shaping the physical and social environment in which they eat, sleep, and play. Now, it is time for action. Parents need to get involved. We cannot stress this enough. Teachers need to get involved. If we see something where we can help or that we can say, it is time to voice that concern. Also, in the minority culture, it is an offense to even talk about it. However, knowing that minorities are at a higher risk could definitely play in your heads to know who to warn and how to go about it. Being a minority myself, I have this great sense of urgency for minorities as well, because knowing how we grow up in our culture can be very, very unhealthy. Another great factor is to be involved with the community. Now, the professionals are already at work. They're trying to create ECE programs, which I will talk about. Now, nationwide public and private organizations are already at work trying to encourage adoption for policies for this ECE program that I just mentioned that promote healthy eating and physical activity. In September of 2011, prominent researchers, young investigators, and leaders in early care and education came together to examine past research and to explore challenges and priorities for future research on healthy weight development in children aged 2 to 5 years of old. Now, this included highest rated issues, assessment of the quality of children's meals and snacks, and then the use of financial incentives. During this meeting, experts and attendees presented the key issues around measurement of diet and physical activity, policy and environment measurement, intervention approaches, policy research, and capacity development. Following the meeting, attendees were invited to participate in an online voting exercise to select top research priorities. Now, a total of 64 research issues were identified, and voting narrowed the list to 24 issues. The highest rated issues included assessment of the quality of children's meals and snack, use of financial incentives, interventions that include health care providers, the role of screen time, and the need for multi-level interventions. Now, this is where parenting comes in, where we are the ones that dictate their food and snacks. And also, we have reverted to this easily, here is the laptop, here is the tablet, here is our cell phone mentality, so we don't have to take care of them. The presentations within this meeting highlighted the importance of research to address the unique challenges for those working in early care and education settings. Expert and stakeholder consensus of priorities identified significant and innovative areas where future obesity prevention research efforts should be focused. And again, there's not much research going on for these kids, and this is where we need to help. One of the programs was called, that refers to as ECE, the Preventing Childhood Obesity in Early Child Care, which is caring for our children, and that focuses on the best practices in nutrition, physical activity, and screen time for all ECE settings. The second program is referred to the Institute of Medicine, or IOM, in Early Childhood Obesity. Its main concern is preventive policies. It really examines the evidence and provides guidance on obesity prevention policies for children. Now, this table that I'm about to go over is one of the many guides out here, and this is here what ECE came up with the research. However, just like anything else in the system, it does have its pros and cons, and here we refer to it as strengths and weaknesses. So I'll go over them briefly so we can see what kind of example they want to provide. Now, this is the measurement method and description of assessment of a child diet. Weight measured intakes. Trained data collectors measure all foods served to or taken by each children throughout the meal. So again, this is kind of somebody at the school checking out what the kids are eating. Now, the strengths, of course, is the most precise assessment of the child's intake. This is very hands-on. However, it does come with the weakness of the most intrusive method and greatest chance for subject reactivity. Particularly challenging for meals served family style. Staffing requirements make this one of the most costly methods. Now, we are already short in the schools as we are, so this invasive method would really need a lot more bodies. Now, the meal observation calculation of foods eaten by each child is based on visual estimators by trained observers. Reasonably precise method, trained observers can assess up to 3 children at a time, thus reducing cost. Some subjects reactivity, but less than weight intakes. Plate weights. Foods provided to classroom are measured before and after meal to calculate average child consumption. Now, this is the least subject reactivity, least expensive method for diet assessment, but it also does not provide individual estimate of intake. Now, the assessment of the child's physical activity. The proxy reports parent or child care providers asked to estimate a child's past physical activity. Now, this is inexpensive, but it does come with very low participant. Now, this is cruder method, less precision. The direct observation, trained observers rate and record children physical activity during the assigned period of time. Now, this is good and reliable and adequate validity, also able to capture the contextual information. However, the observation period is generally limited, therefore not able to capture the habitual activity. Now, we also have accelerometers, which is objective measurement of physical activity, considered to have good reliability and validity, low subject burden, able to access habitual physical activity. See, this would, however, capture large amounts of data, which must be reduced. Disagreements about cut points and interpretation of data more costly than other methods, however. Now, this would be the measurement of ECE policies and environments. Now, the nutrition and physical activity self-assessment for child care, which is known as the NAP or the SACC. The self-assessment is a brief instrument that child care providers can use to evaluate their environment, policies, and practices. This is quick and easy. It's very minimal participant. The burden is inexpensive. However, this is designed as part of the NAP SACC program, intended primarily as a process measure, not for evaluation of a true effectiveness. Now, the EPAO, a protocol is comprehensive measure of the child care environment policies and practices. Include a document review 90 minutes and on-site observation of 102 items. As you can imagine, this protocol was developed as an outcome measurement to assess the impact of the NAP SACC intervention, but has been used by other researchers. It's the most comprehensive measure of the kind available. It has demonstrated reliability and validity as a measure of nutrition and physical activity policies and environmental characteristics at childcare. However, this is very expensive to implement, and it requires special training and certification of data collectors. Now, the Wellness Childcare Assessment Tool, it focuses on assessing strength and comprehensiveness of policy using 65 document review. Now, it has demonstrated reliability and validity as a measure of nutrition and physical activity policies and environmental characteristics at child care. Less expensive to implement, however, it is less comprehensive compared to the EPAO. Now, this is a lot of information, and we still have a long way to go. One of the many ideas out there is to create, but however, the closing arguments, the main thing is for us to start creating a healthy environment. Creating environments that promote healthy eating and regular physical activity before children develop poor habits is critically important for obesity prevention. However, research in the ECE settings is in its infancy. So thank you for your time, and I hope that this